Welcome back, everyone. Today we're going to be talking about how you can help your low back feel better during your pregnancy and avoid that all too common pregnancy low back pain, and how you can also help support your core during pregnancy and prevent diastasis recti. If you're not familiar, diastasis recti is when the left and right halves of your rectus abdominis muscles, which run from your ribs down to the top of your pelvis, when those separate and we get this space between the two halves of those muscles, that is a condition called diastasis recti. And that can be problematic over the long term and something that you want to avoid as best you can. So you're going to want to take your handy phone charger and we're going to look at where your pelvis is in relation to your ankles. So taking your phone charger, you can drop it down, the heavy end towards the floor, and just notice, does that fall over the front of your foot or does that fall in line with your ankle? And specifically, there's the bony nub on the outside of your ankle called your lateral malleolus, if you want the anatomical term. That's what we're looking to stack our pelvis over. And you can take your pelvis and feel from the top of your pelvis, feel down. There's kind of this bony knob where if you bend your knee, you'll feel it move underneath your fingers. And that's the top of your thigh bone. So we're taking the top of your thigh bone and stacking that, using that as our marker, our objective marker, to stack that over our ankles. The tendency for most women during pregnancy and even prior to pregnancy, because we carry this habit with us into pregnancy, the tendency is to have our pelvis shifted forward to a greater or lesser extent. And then as we are growing a baby, that tends to become to a greater extent. And we get the pelvis shifting way forward and the torso way back because we think this is chest up, shoulders back, good posture. When in fact, what we're actually doing is really compressing our low back in the process. So when I have my pelvis shifted forward and my shoulders back, I'm decreasing the amount of space that is present between the bottom of my rib cage and the top of my pelvis. So I'm making this space shorter. I'm putting these muscles in a shortened position and I'm compressing my spine and the discs in this area. Whereas when I stack my pelvis over my ankles and I bring my torso over my pelvis, I'm lengthening these muscles and creating more space between the bottom of my rib cage and the top of my pelvis. You might find when you back your pelvis up that you feel like you're going to fall backwards. Part of that is a couple things. You may have left your torso back behind you so that when you back your pelvis up, your torso is pulling you back. So make sure that your torso is stacked over your pelvis when you back your pelvis up. This will feel slumpy, okay? I promise you, however, that you are not, even though you may feel like it, you are not in this position. You are, in fact, when you stack your torso over your pelvis and relax the front of your ribs down into your abdomen, what you're actually doing is you're allowing your abdominal muscles to better support your growing uterus and baby, all right? So when you have your ribs stacked over your pelvis, this sets your abdominal muscles up to be able to do a better job of supporting your core and your growing baby. And this is one of the big things that contributes to diastasis recti, this habit of lifting the rib cage up and forward, lifting the chest up, creates a lot of strain on this structure that runs down our midline called our linea alba. And this structure is the anchor for all of our abdominal muscles. And it needs to be able to stretch in response, or to lengthen in response to what is growing underneath it. When we lift our ribs up, when we lift our chest up, we're actually putting additional strain on that tissue, on that structure, and something's got to give. And growth is going to continue to happen. So that means we're more vulnerable to separation at the linea alba of those left and right halves of the rectus abdominis. So do yourself a favor, do your baby a favor, drop your ribs down, slump. You will feel slumpy. I promise you this is not the end position, but this is going to be really, really beneficial for your low back and for your core muscles. It's also going to set your uterus up to be better aligned in relation to gravity. So when I have my pelvis shifted way forward, my uterus is actually tipping, the top of my uterus is tipping forward, the bottom of my uterus is angled back, so it's a little bit like this, because I don't have my core muscles able to support it. And ribs and pelvis are in two different places. When I stack my ribs and my pelvis over each other, relax my ribs down, then my uterus is in a more optimal relation to gravity, which also means that it helps to set the baby up to be in a more optimal position. We can't guarantee that this is going to put baby in an optimal position, but it definitely helps to facilitate that. So your goal for today is to see how many times can you catch yourself with your pelvis shifted forward. Are you standing at the counter, resting your pelvis against the counter? Are you holding a baby or holding a child or wearing a child with your pelvis shifted forward and your torso shifted back? And if so, can you back it up? Another benefit of this that I forgot to mention is it's going to help your feet. So foot pain is something that is pretty common with pregnancy as well, and some women will report that their feet grow when they're pregnant. Well, it's not that the bones grow, it's that the ligaments lengthen and the structures but the structures get longer in response to that, okay? So when I'm asking the front of my foot to support most of my weight because my pelvis is shifted out and over my forefoot, that's loading the front of my foot more than is really optimal. And so not only am I loading it with my own body weight, but now that I'm growing a baby, I'm also adding that load to it as well. And that's not really how our feet are designed to work. So when we back the pelvis up, then we have the back portion of the foot that is more solid, more dense. That is the portion of the foot that we want to be the primary support for our body. We want most of our load to be carried by that part of our foot versus asking these more thin bones, more ligament dense areas to do the work. So back it up, you'll help your feet, you'll help your low back, and you'll also help your core. All really, really important things as you continue in your pregnancy. So have fun catching yourself and shifting this habit bit by bit if you need to, and enjoy.